So first off, I went and looked at the number of responses to the survey. Only 35 responses, which means that we need more responses. So if you haven't taken the survey, I'll resend the link out. So take the survey and also send it out to people, other students that you know, and ask them to take it. Because 35 is not enough. Need more responses. Need to get 100. That would be the ideal thing to do. So send it out to everyone. Beg them to take it. Promise them a pillow. Well, promise them that they'll be in the draw. They'll have good odds of getting a great pillow. Any questions about the survey? Did anyone take it? Write in the chat if you've taken the survey. How long did it take you to complete the survey? Five minutes? So not very long. So maybe write to tell people it's not going to take more than 10 minutes. Did it take anyone more than 10 minutes? Yeah. So send it to people and say that it only takes about 5 to 10 minutes to take. So because that's oftentimes, in fact, we probably didn't put in, Rudy probably didn't put the little measuring thing that shows how close they are to the done with the survey, but that's okay. We'll just tell them it only takes 5 to 10 minutes to take. Good. Any questions about the survey? Because we're going to go through it next week in class, so that's why I want to make sure that we have enough responses to basically go through and to say something about the results. Okay, today I'm going to talk about translational research. I started talking about this on Thursday, but we're going to get through it. So we're going to go through translational research today. Then after Thanksgiving, we'll go through on the Tuesday, we'll go through the basically research in public health. So give a kind of an overview about the different types of research that happens in public health, and particularly about evaluation type of work. And then on Thursday, we'll probably finish up that lecture, and then I'll go through the results from the survey. And then your assignment 5 will basically be about the survey results. All right. So last time I started talking about how, well, first off, any questions before we start? I'll give a second to type in any questions. Okay, seeing nothing come up. So last time we started talking about that there's 3 types of ways that you can use there are 3 types of views about how what research does. So one is that research is data, so that what the idea of producing research is that you produce data, and that the idea is that data that goes out and you publish it or you make it known to people, and then the world kind of uses the data as they see fit. The second way is research as ideas. That is, that research is a way of adding to theories. So the idea is that you've got theories, and so what you're doing is you're doing research to test your theories. So the research as data, that's kind of based on the assumption is that, well, what you're doing is you're doing the good for the community and for the world by just letting them know more about what's happening. The research ideas is that you've got some type of theory, or you've got some type of notions about the way the world works, and so you're using your ideas to sort of enlighten those theories. And then the third one is research as an argument. And so research as an argument, what that means is that you're doing research as a way of contributing to policy debates, or contributing to some type of discussion that's going on. So this is more focused than research as data, where research as data, you could just say what cancer rates are in Merced, and you're producing research as data. Or research as an argument, you're saying, well, you're going to now give data that sort of says, should we do something about cancer rates? So this is where there's a distinction between research and advocacy. So what we do in the universities is that we do research. What nonprofit groups do is they do advocacy, and there's a difference. So research in universities, what we're doing is that we're trying to basically, provide the information that's discovering the truth and expanding our knowledge. But the idea is that, we're coming up with a topic that we want to look at. We go through and that we, read everything on that topic, and then we do studies to add up to the knowledge of that topic. Researchers' advocacy starts with the idea is that they've got a certain type of position that they want to advocate for. And so what they want to do then is gather information that goes through and supports that position. So advocacy is much more about choosing the information that supports an argument, the side, where research is about being more balanced. Now, in reality, people don't just happen upon research questions just by, because they just suddenly one day say, I think I'm going to go out there and look at this. No, they do it because they have some type of reason. And oftentimes researchers, well, all the time, researchers are not unbiased in this. And that researchers then go through and that they have positions that, that they care about. But there is a line between research and advocacy. And oftentimes people who do research where they have a particular type of bent is, a position, is that they have to be careful not to cross over that line from research into advocacy. Okay, that means that as a researcher, you have to be independent and not be advocates. But at the same time, researchers want to be relevant. You want your research to be relevant. And so, it means that what you're looking to do is that hopefully you're going to choose an area and choose a research topic that's going to somehow inform a debate. And that debate can kind of have three different types of outcomes. It can, be aimed at changing behaviors. So, what people do, changing practices, so how the healthcare system works, or changing policy or funding. So I'm not sure if you remember this, but in the first class, I kind of showed you this, and I said, well, this is called the policy cycle, where essentially you have determinants of health. So you have people, getting them, having poor health for various types of reasons, and that then there are needs that are identified, and then the health services respond to those needs. And that then as a result of that, there are unmet needs that kind of occur. And then policymakers or whoever it's going to be, prioritizes what they, how to respond to those unmet needs. And that's you change policy or you change funding, and you get new types of, changes in how things are done then. And the interventions can be either kind of focusing upon changing determinants of health, or they can be focused on how healthcare providers operate. But if that's the cycle, it goes around like that. So you can see is that there's these three areas, which is basically changing behavior, changing practice, and then changing, policy and funding, which is all done by policymakers. That's going to determine, who ultimately is going to be the target of your research. So it means that when you're doing research, it's like one of the first things you need to do is to identify, well, where do we think, which of those types of boxes or groups or those areas is going to be the most interested in our results. So in terms of how you go about doing this, then is that there are sort of three different types of areas that we'll talk about. So one is dissemination of translation of research. The other one is changing practice, and the third is changing policy. By policy, we mean either policies like, we're going to require healthcare providers to do something, or funding, mean that we're going to fund new interventions, or we're going to do something, but it's basically a policy response by government. So starting with translational research, has, it kind of has arisen in the last 20 years as being kind of a major focus of agencies. And the idea of translational research is that, no longer are you just kind of doing research as data, that's doing research to sort of put it out there, but instead what you're doing is you're doing research that's going to have some type of impact on people's lives. And there are a couple of different ways to think about translational research. So traditionally, when they talk about translational research, they talk about bench to bedside. And what that means is that, they're talking in that case about taking basic science and saying to basic scientists, well, all right, so what's going to be the implications, or what's the thing that your research is going to lead to that's going to help people? And so I think I mentioned that when I first got to UC Merced, and I was talking to a lot of the biomedicine people, and that over natural science, and I said, so what's your research ultimately going to lead to? And mostly they said, oh, new drugs. They're doing new drugs. So what they're talking about then is that they're not actually going to do new drugs. But what they were talking about is that they were the research that they were doing was not going to just be producing data, and it wasn't going to be sort of theoretically kind of just to test for theories, but rather it was going to be to lead to some type of drug development or some type of medical device or treatment patients for option, but something like that. So that's one type of translational research, to go from basic science to sort of the next, to move down into developing things for clinical practice. The second way to think about translational research is that actually translating it from just getting some type of new drug or new treatment to actually putting it into practice. So with that sort of, according to this approach, it says, yes, bench to bedside is an important type of step in translational research, but it's only one step. Is that just developing new treatments or new drugs is not necessarily enough to ensure that the health of the population is improved. Instead, you need to go through and take the next step, which is to go through and to think about, how do we actually implement this? So that's what the second type does. And so essentially you end up with, now they talk about 3 different types of translational research, and they're called T1, T2, and T3. So oftentimes you'll start hearing people talk about, oh yeah, T1, I'm doing T1 translational research, or I'm doing T2. What that means is that it's sort of the different type of level of where they're targeting. So T1 is this bench to bedside, which means basic research to some type of clinical trial research or some type of new drug or something that they're going to test within some type of it's going to lead to some type of clinical trial, something that can be done for people. And then T2 refers to how you go from clinical trials into actual practices and communities. T3 then, what that means is like, how does it actually get implemented? So if you think about like T1 is developing a new drug, T2 is trying to figure out, all right, so with this new drug, how are you going to get it into how should it be used in treatment? And then T3 is actually looking at how specifically you should use this new drug in treatments. And so this is a kind of a graphical representation of that, where you have basic research that goes into bedside, right? That's the T1, bench to bedside, and bedside obviously means patient's bedside. So it's something that and so this means this kind of, sort of thinks about culminating with a sort of a phase 3 clinical trials. If you remember, let's talk about clinical trials, sort of an efficacy type of trial. And then into practice, well, this is where they split it up into, 2 and 3. So stage 2 is basically, looking at how you go through and actually implement this, how you would implement this in terms of practice. And then stage 3 is actually going through and seeing how you implement it and disseminate it. So this T1 to T2/T3 is actually now the process that they talk about, going from basic research into actually changing, something around the way that people, what happens to people. So then there's also, they talk about T4, and T4 then, that looks at some of the other aspects. So it goes beyond just delivering a treatment in how do we get into clinical practice? But instead it goes into how does it actually impact people's lives? So T4 translational research is where they would start to look at things like, people who don't have access to care, or how do you make sure that doctors in underserved areas, are also going to be assigning, using these treatments, and how do you get people access, and all the different things that we, kind of think about when we start talking about public health, about how to ensure that there's equitable access to things, kind of goes under T4. So if you take an example, suppose you want to improve the health of people with diabetes. So you have biomedical researchers seeking to understand how to how diabetes forms, and what can be done to prevent people from getting diabetes. You have clinical researchers, how best to treat people. You have health behavior researchers seeking to understand how best to help people control their diabetes through exercise and diet. So if I were to say, all right, so what's the T1, T2, T3, and T4 from this? Well, T1 is basically the bench to bedside, right? So that's the new diagnosis, treatments, etc. That's getting the biomedical researchers to go through and to start looking at how how you develop this into something that's a clinical trial. T2 and T3 then is going through it and looking at how you get these improvements. Once you've done a clinical trial, how do you actually get it into practice? So that's the behavioral researchers. That's also the like if you look at a lot of the UCs who have medical schools around here, a lot of the UCs, like Davis has one and UCLA has one, they'll have a center for translational research or translational medicine. And if you look at it, what they're really looking at is basically this T2 type, T3 type of research. Because in medical schools, there's a lot of T1 type of research that goes on. They have basic scientists. They're going through and they're looking at how you develop new types of treatments and new drugs and everything else. And so T2 and T3 then is that what these universities have is that they have centers by which you can now go through and figure out how to put into clinical practices. So a lot of the training that doctors have to go through, like doctors after you become doctor, you have to keep on going through continuing medical education, CMEs. And CMEs can take a lot of different forms. Like, I think I told you about me going down and talking at a golf course with doctors that were all kind of getting nice dinners and everything else. That was CME. That was continuing medical education is what they were doing. So all doctors have to do that. So what a lot of the universities do is that they offer through their translational research centers or translational medicine centers, they'll bring doctors in and give them continuing medical education about how what types of new treatments you might use for a drug, how you might detect it, that kind of thing. That's really all this T2 and T3 type of research. T4 then, that's not usually an aspect of these translational medicine type of centers at UCLA or Davis. Instead, T4 tends to go, public health departments do a bunch of T4 research, where they're basically trying to look at how do you actually promote this thing in the community. So T4 then becomes the focus of just because you've got this, into clinical practice now, how do you actually get things to change people's lifestyles? Which leads to dissemination. Because if you look at that graphic in that little picture, like if you notice down here, it says T3, dissemination research and implementation research. So there are actually areas of research called dissemination research and implementation research. There's journals of dissemination research and journals of implementation science, where what they're doing now is that they're sort of taking this idea that they're trying to treat the dissemination process and the process of actually getting people to use these things as a science. So rather than just kind of sitting around and saying, well, now that we've developed this new drug, let's just go ahead and start selling it and see what happens. Rather than sort of taking that type of approach, it's more like, all right, so how can we systematically study how to go through and get the message out to people and change people's behavior, and then get treatments and different type of procedures implemented into practice. So dissemination research then, it's a planned process. So it's not just, don't think of dissemination as being just, oh, we're going to make up some flyers and hand them out. Instead, it's got to be something that's planned, and it's also something for which it's supposed to be seen as a research process, right? As something where what you're doing is you're looking at the question about how can we get the best uptake of whatever it is that we're trying to disseminate. So it really becomes something about decision making, about how do people make decisions and how do you provide information to them in a way that gets them to change their decision making. So the steps in dissemination research, core to this is the stakeholder engagement. Now, what's a stakeholder? A stakeholder basically means who your primary audience is. And so stakeholders are going to differ based upon, kind of whether you're doing behavior change, whether you're doing practice, or whether you're doing policy or funding, right? Those are the three areas that kind of we identified. Well, the stakeholder is going to be different. So if what you're looking to do is to figure out how do you get people to change their lifestyles in the community. Well, now, you're talking about community members are your stakeholders, and so, or community groups who work with them. And so that becomes your stakeholder group. On the other hand, if you're looking at, how do you get teachers to go through and to promote exercise, or how do you get doctors to change their behavior? Now that's your stakeholder group, is basically healthcare professionals. And if what you care about is you care about how to go through and get the state of California to basically put more funding into outreach for hepatitis B treatments, is that now means that that's your stakeholder, is the government officials. So your stakeholder then really depends upon where you think that, where you're going to try to target having an impact. So once you identify who your stakeholders are, and you go through and that, the idea is to involve them in your process. And, this is where you get into the linkage of going from a, helicopter type of science where you just do your research independently to a complete community-based participatory research. Usually once you identify your stakeholders, is that you're going to end up somewhere in between there, where you're involving them, but at the same time, you're not necessarily letting them dictate or asking them to make all the crucial decisions about how you're going to do research. So once you identify that, then what you want to do is think about, well, what's the type of outputs that group is going to be resonate to? And it really does differ. So, if you're thinking about working with community members and you want to promote diabetes prevention, is that then you need to have forms of dissemination that's going to reach community members. On the other hand, if you're dealing with doctors and you want to have the healthcare professional change, then you're probably going to be talking about a different type of way of reaching them. And finally, if you're doing government officials, if you're doing policy, then that's a totally different way of trying to communicate to them. So the types of ways that you communicate them, that's at the format of your dissemination, depends totally upon who your group is going to be. So, some of the other principles of dissemination is you want to utilize opportunities. That means you want to build partnerships and establish networks, regardless of what level you're going to focus on. You need to understand the context of the research. So this type of, when you're thinking about dissemination, then you can't be devoid of what the real world kind of looks like. And so, one of the ways that you kind of deal with this is that you get a group of stakeholders, and with that stakeholders, then that's the group that you try to understand what the context is. So, that's partly going to determine kind of the type of information that you're going to try to disseminate and how you're going to disseminate it, but also in terms of when to do it. This idea of timing becomes really critical. So, for example, if you're doing research that has implications for California Department of Public Health, or it has implications for the government of California, all the state legislatures all kind of convene in September, and they all write their bills in that first period of September to December, and then they vote on the bills in January through March. So if you're going to do something, you got to think that that's the time that you're going to introduce stuff. It doesn't do much good to go into the state legislature in summer to start talking about something, because no one's there, and it's not the period at which they're going to be doing policies like that. So the questions to answer when you start off like this is then, who's your audience, right? What are your key messages? What are your recommendations? And remember, recommendations is not the same as advocates. So oftentimes the forms that recommendations take is more like options. So you say, if what you want to do is this, if what you want to do is to increase the number of people who are getting diabetes education, then here's your option. Here's the recommendations for how to do that. So you're couching your recommendations not as this is what should be done, but rather as if this is what your goal is, then this is what we recommend them from the literature, how to achieve those goals. And it's really the difference between advocacy which is that you're arguing for something, versus research where you're not. So a lot of times when we write reports, what we do is that we will say, option one, here's option one, option two, option three. And so we give different types of options for how to proceed. And the options can, we make very clear is that the option you choose depends upon what your goals are. So we don't try and tell government officials or tell people what their goals are. We just say, if these are your goals, and a lot of times it's really self-evident, because if you're working with public health department and they say we want people to get diabetes training, then you don't have to kind of give the arguments for not giving diabetes training. But what you can do is that you can say the pros and cons of each of the different types of arguments, the ways of getting diabetes training. So then in terms of the options for dissemination, again, there's a whole bunch of different ones. One of them I'd point out here is journal articles. So, writing up the results, that's something for oftentimes people, they think about the whole publishing process as something that's, I don't know, something that academics do, but that doesn't really matter that much. But what I found, and especially dealing with government officials and policymakers, is that they put a lot of emphasis on academic publications, because the way oftentimes that within the local public health department, the way that they kind of operate is that they come up with ideas for what they want to do, diabetes prevention, and then they have to make the argument to supervisors, county supervisors, whoever it's going to be, to essentially that's what they should do, and that's what the county should fund, is to go out there and fund diabetes prevention. And so, making that argument, what they do is they look at kind of getting the best type of evidence. And so what journal articles do is that they provide peer review, they provide evidence that everyone knows is peer reviewed, and everyone knows is that's gone through some type of rigorous process for being published. So, that's the importance of the peer review process, is that it's different than just a report that some community group can write on that has no assurances that it's gone through any type of rigorous process, but journal articles do. It's what makes journal articles so much different than every other type of information source. Okay, so here then is our basic steps that you can take, and that and you can think about the type of things that you can do sort of internally, and the type of things that you can do with an advisory group, a stakeholder or community advisory group. So in terms of develop the initial research idea, is that there are a number of things that people can do internally to kind of develop your idea. But then what you can do with a community group is you can get input in terms of where the important research areas are. So then, once you refine the idea, then you can take it back to the community group, and the community group can then provide feedback to researchers on the ideas. So if you think about, let's say if you're going to do some type of process of looking at how to prevent diabetes in the community. So you as a researcher would come up with all these different, you'd come up with your ideas for how to do it. And then what you do is you can convene a stakeholder group of community group members, and also of different types of county officials, to essentially say, okay, so we're going to look at how to go through and address diabetes, and we want to, here's some different ideas that we've seen. So you get their feedback, then you go and you refine it. Then you come back to the group again and ask for feedback and say, now specifically, we're thinking about these things. And so what the outcome of this process is then is that you come out of those community groups with a very firm idea about what it is you're going to do. You then conduct the research, and that and this is where your stakeholder group kind of comes in to provide guidance for you in terms of how to produce the research, how to get information from people, to recruit people. Oftentimes you use your community advisory group or your stakeholder group to essentially make the inroads in terms of gathering information. You then go through and that you interpret the results, and then you bring the results back to your stakeholder group, and that you then within your stakeholder group, you get their response to what they think about the results. And then for the dissemination is that you basically use you rely upon your stakeholder group to help you understand what the best way to disseminate the results are. Then finally, identify next steps is that then you would get your stakeholder group to go through and to help identify, well, all right, so what's left? What's the next thing that needs to be done? So those are the basic type of things that you would do if you're going to go through and do, and try to look at how to involve a stakeholder group in the process of developing your research, but then specifically down here to when you get to dissemination, because all these steps up to here are all designed to make sure that you're doing research that's relevant. And so this is the stage then that you come in, that you're going to say, okay, so how do we then, how do we translate back our research or disseminate back the research finding back into the community? Okay, so in terms of the study that you're doing, that you've helped design with the, or that you have designed, we really haven't talked about dissemination at all, right? We haven't talked about what you would use your results from. So, this is the point where probably you need to start thinking about, and because we're going to talk about this on next week when we get together, is essentially, well, all right, so what is the, what is the potential use of this research that comes out? So let's say that you go through and that you find is that there's a big link between on-campus sleep and or lack of sleep. That's tough to sleep on campus, and that has bad implications for your outcome, for your academic performance. Well, the next question is going to be, all right, so who would care about this, right? Who would go through and actually be the ones that you would talk to about this, that would then go through and kind of, would it be student services? Would it be the provost? What level do you want to go through and try to raise the awareness of this? And then what kind of changes that come out of the research would you suggest happen? So that's all the kind of the dissemination and translation phase of the research. Okay. Any questions about that? I'll pause and check the chat. Any questions then about translation and dissemination? Okay, the next thing about when you're done with your studies now. So translation and dissemination deals with the question about how do you sort of make it impactful, right? The second thing we want to look at is, or discuss, is how do you make it sustainable? Because oftentimes what happens is that when a researcher does research, she would sit back and think, okay, I'm really interested in academic performance and sleep, and so therefore I'm going to go ahead and conduct this study. I go out there and I gather all this information. I find out that there's all this, this type of changes that need to take place. And so what I do then is I think, well, I think what I'll do is I'll develop an intervention. And my intervention is going to be, I'm going to make one dorm be quiet and make another dorm not be quiet. Let it just be as it is. And then what I'll do is I'll check to see, does academic performance improve in the quiet dorm over the not quiet one? And yeah, so let's say you do that. And then you find that, yes, it improves. So you've come up with your intervention. Well, as a researcher, you think, woohoo, you can publish that. You can say, I did a clinical trial. I did a randomized controlled trial about these two different dorms, and I got one that's quiet, and academic grades just went up and up and up and up. And I had another dorm where it wasn't quiet, and they went down. And so therefore, this shows that my program of developing these types of interventions for quiet dorms works. Well, now the question becomes, what happens when you're done with your study? And this is the case, this is the question that researchers all over the world face. Anytime that a researcher comes through and tries a new clinical trial, tries to develop a new drug, any type of clinical trial research that goes on, is that there's the question about, well, what happens when you're done with it? As that, who is it that's going to take this up? And there are usually the three different type of options for who's going to take it up. You can develop one type, your focus can be, oh, well, I want Medi-Cal. to now fund this type of intervention. Another possibility is you say, well, I want healthcare providers to start doing my intervention. And then the third, you could say, I want individuals to basically take up my intervention. So a good example is if you, let's say you develop a breast cancer, a support group for women with breast cancer, right? Which has been done a lot, and they've been shown that, support groups for women with breast cancer is that they lead to better psychological outcomes. They lead to better kind of health outcomes, kind of long term. And so, there's a lot of positive things that come with support groups for women with breast cancer. What happens at the end of those trials, though, is that they kind of conclude. So the researcher's gone through and has run these trials for women, and that they published got the results. The results all show these positive type of things. But then the question becomes, well, so what now? So oftentimes what happens is that they turn to a funder, to the Medi-Cal, whoever it's going to be, and say, oh, you should now fund these type of breast cancer interventions. Or they might go to the hospital and say, hospitals, you should offer these breast cancer interventions as part of your regular type of services to women with breast cancer. Or they can go to individuals and say, hey, these things can be offered and you should pay for them. So as a woman going through breast cancer, you should pay an extra $50 or whatever it's going to be to basically, have these programs offered, and then they can be offered going forward. But those are kind of your options for when you do an intervention. You either get like an overall government funder, you either get healthcare providers to do it or some community groups, or you get individuals to pay for it. But that's how you make an intervention sustainable. So this is a problem that's been identified. And so what they've tried to do is they've tried to come up and to kind of formalize the process. So the one step in formalize the process is to formalize how the reporting of randomized controlled trials. So there's something that's called the consort statement. And the consort statement, what it is, it's basically a system of a flow diagram of how you should run randomized controlled trials. And it turns out to be really important because nowadays, if you want to do some type of randomized controlled trial, regardless of whether you're in medicine or psychology or sociology or whatever it is, if you're going to do a randomized controlled trial in health, you actually have to go on to the website before, and you have to register your randomized controlled trial before you start it. You have to talk about what your aims are, and you have to go through and say how many people you're going to have, and what your primary outcome measures are, and what you think so you essentially have to fill out this you have to document before you do the study what you think is going to happen. Then you do a randomized control, then you do your study, and then afterwards, then that's when you go back on there and you state what happens. But because what the consort thing does, though, is it looks to see, was your stated goals the same as what you actually ended up at the end of it? Because what they're trying to avoid is people just sort of doing randomized controlled trials that, and then your main thing didn't work, but this other thing worked. And so then you said, oh, well, that's really what my aim was this other thing. So that's the idea behind these consort statements, is that they give kind of a way of documenting, for you to document as a researcher, what you expect to do going through. Well, it was quickly realized is that, well, the consort statements kind of what they deal with is randomized controlled trials, and randomized controlled trials, they deal with efficacy. That is, that randomized controlled trials are all about how to make sure that something is efficacious, that is, that it works in ideal conditions. But it didn't necessarily deal with the question about effectiveness. That is, that does it work in the real world? And so there started to be different types of guidelines that would come out about, well, all right, so how do you ensure that once you get done with your randomized controlled trial, how do you ensure that there's some type of process of going through and seeing whether or not it's going to be translated into effectiveness? So that's where these re-aim guidelines came out. I forgot what re-aim stands for, but essentially it was a set of guidelines that came out to try to go through to deal with this idea about how do you take randomized control trials and look upon them in terms of as effectiveness trials. And so one of the things that they pointed out was that, well, there's something called a type 3 error. So, type 1 errors and type 2 errors on statistics refers to, do you falsely reject the null or do you, falsely accept the null, right? And what type 3 errors pointed out is that, well, it could be is that you get the results of it wrong because your study was just administered poorly. And so because of this idea that, well, we need to make sure that when you go through and you're going from an efficacy trial to an effectiveness trial, is that people are actually doing it correctly, is that you need to have some type of guidelines. So that's where the re-aim came in. The re-aim kind of, was said that, well, when you go through and that you're doing a trial, then you need to focus on what your reach, your effectiveness, how it's going to be adopted, and how it's going to be implemented, and then maintenance over time, that this is where the sustainability kind of comes in. And so nowadays, if you look at the consort checklist, because there's a checklist, you'll also see then is that there's all these, there's also a checklist of things that you have to do to kind of hit the re-aim type of goals. So when you do interventions now or studies, you not only have to be aware about how to go through and register your study to make sure that it is consistent with the consort guidelines, but then you have these other type of guidelines as well, where that now you're looking at this issue about, well, how are you going to go through and ensure that there's some type of sustainability. So I'll give you an example. There was a large randomized control trial that occurred in school kids across the US. This was maybe about 10 years ago. And so what they're doing is that they had selected some sites from around the country that they were going to, some schools, right? And that they brought in these special ed teachers and that they came in and that they work with the kids and that they, train the teachers, work with the kids. And then they, in terms of how to get more exercise out of the kids. And so, just in their normal type of exercise class that they have at school. And so at the end of the year, they looked at the results from this and they compared the schools that had the intervention versus those that just had the control group. And they found that the intervention group was much more successful. Kids had much better physical activity. They could much more, they could run faster and they could run longer and everything else. And they had lost, the weight was less. And so there's all these positive things. So then what they did is they looked to see, all right, so what happens after a year from year 1 to year 2? And at the end of year 2, they compared the two schools and there was no difference. The school that had done well after 1 year went back to basically just being equal to the school that had the control group. So the question is, well, why? Why did you have a success after 1 year, but not after 2? Well, because what had happened is that the 1 year was basically an efficacy trial, right? The researchers had brought in the physical education teachers who were specially trained. They did the things with the kids. So the kids were getting trained, getting their exercise from these specially trained education teachers. But then once the education, specialists left, the assumption was with these teachers that were in the schools with the clinical trials, they would just continue doing it from there on. But they didn't. Instead, they went back to doing what they did before. And so it kind of highlighted that, well, in this case, the problem was, not an efficacy problem, because the trial was efficacious, meaning that it had some positive results. The problem wasn't an effectiveness problem, and that once it was implemented, is that it didn't work. And so, they realized that, well, actually the training shouldn't have been focused on kids. The training should have been focused on teachers, because really what you want to do is in order to get sustained results across time, you need to go ahead and to focus on training teachers about how to do this and let them do the work with the kids rather than working with the kids. That was a problem of sustainability. So the point being is that clinical trials and behavioral interventions, they follow the same type of pattern, and that they all get to this problem at the end of it as what next. The re-aim kind of, what re-aim does is it tries to come through and to say, well, here's the things you need to do in order to make sure that there is some type of sustainability or what they refer to as maintenance of the program afterwards. Okay, third thing, research to policy. So, the goals of, research to policy means like, how do you go through and change basically decision-making, either funding or policy decision-making. So if you think about, what the role of us as researchers are, then when it comes to to government's policies, to either county government or state or federal government, is that you can kind of think about in those two ways, that what we're doing is we're producing information that then they will use, right, which is an important part. Or what we're doing is that we're developing, we're trying to developing arguments, or we're trying to developing research that directly impacts an issue that they're looking at. What you'd like to think is that we're doing the latter. That's that you would like to think that what government's doing is that government is looking at the research, that government officials are looking at the research that's been done, and then making decisions about how to go forward based upon that. And so you have this kind of evidence to policy type of flow, whereas researchers produce evidence, and that leads to good policy. So this is called evidence-based policy, becomes kind of the term that this is used. And you'll see this used a lot when you start getting into the policy literature, as they talk, just like how there's evidence-based medicine, which is the whole idea is that you're trying to go through and to change clinical practice to make sure that it's consistent with best evidence. The same thing for policy. So you're trying to change it to make it so that policymakers understand kind of how to go through and to use, rely upon evidence. And so there's different types of ways that this has kind of occurred. So, for example, there's an evidence-based medicine. The Cochrane collaboration they compiled evidence-based medicine. The databases for evidence-based medicine. There's been similar things that have been tried for policy. And so there's been different types of policy groups around in universities that what they'll do is they try to sort of consolidate through meta-analysis and other things, what should be, what are the best type of practices. So this is something that, that's been university people have been thinking about for a long time, which is that how do we go through and make sure that these policies that government are developed are based upon the best evidence. The problem is that it was also noticed early on is that this was not necessarily the way that things actually operated. That is that, what people start to, researchers start to notice, and especially researchers who start to deal with policymakers, is that oftentimes within an organization like California Department of Public Health, just to pick one, or any state government, is that sometimes what happens is not that, that they think, oh, we have this, this issue, let's see what the best type of policy is. And then they go and they get the evidence, and then they develop the policy based upon the evidence. Sometimes what happens is that politicians come through with particular type of things that they want to do. And so then what they do is their staff, basically the organizations, look to see what's the evidence that will support this type of policy. So there the question then is, okay, well, are you getting evidence-based policy, or are you getting basically evidence that responds to a policy? Does it go evidence to policy, or does it go that they come up with a policy and then everyone tries to figure out what the impacts of that policy is going to be? And sadly, oftentimes it's the latter, is that when they start looking at how policies are actually developed, because there's sort of two ways to think about policy research. If you ever want to go into policy research, there's the what should be type of research, right? So that's what I do. I do the what should be research. So what I do is when I do different types of studies, I kind of look to see, well, what would be the implications of this policy, or what would be the implications of that policy, and then kind of get the evidence. And so I'm doing the what's the best policy based upon the evidence. That's a should be. The other type of policy research that's done is is more the how are policies actually developed. And you can think about this as more as the sausage making type of policy thing, where it's not looking at how do we actually come up with a COVID policy, based upon the evidence, but rather in reality, what happened politically that led to these types of COVID policies. So, if you look at COVID's a great example, because if you look at how the CDC responded, there's nothing in that. Yeah, if you were to take this, let's figure out whether the CDC's response was evidence-based, you would say no, it wasn't evidence-based. The CDC's response was politically based, that then they tried to justify with evidence afterwards. But the CDC's policies came from political pressures, not from evidence-based evidence-based research and guidelines. So that's a case where COVID is a great example of where you had policies and then the evidence tries to figure out what the impacts of the policies are, as opposed to the way that in the ideal world it would work is that you have evidence and then they develop policy based upon the evidence. So what's the implications of this? Well, there's been researchers throughout the years that have looked at kind of this. And what they find is that, well, it sort of comes out in that in the tensions between policymakers and researchers. So what researchers say, right? What policymakers say about researchers is that policymakers say, like, the government says, one is that the research community is too slow, right? They answer, the questions that policy needs to answer they need answered like in 2 weeks. Not in that researchers, when we do research, it can be a year process, a 2-year process. So one is just a timing problem that goes along. The second thing is that they say is that, well, so that research, because we just sort of focus on the types of questions that we can answer, they're often not the types of questions that policymakers want. Policymakers, want answers to difficult questions, and researchers tend to try to break down difficult questions into very, very discrete type of blocks, which takes too long and doesn't really give them any type of assessment about the bigger picture. Researchers who deal with policymakers say that, that the criticisms was that, well, one is that they just want immediate answers. So they don't really want research. They just want immediate answers. Is that they they oftentimes want answers that are consistent with their policies, not necessarily, ones that are going to be they want evidence that they research as an advocacy for their policies, not independent research. And that they often want very simply, so they just want sort of 3 bullet points is all they really want. And they don't want to cost very much or take very much time. So there are ways that different types of countries have tried to deal with this. So a good example is the Canadian up in Canada. What they tried to do in Canada is that they tried to go through and to make it so that every time that there was a government, there was a grant that came out to a university for some type of health related research, is that the university who got the grant had to have a policymaker as a member of the someone in government as a member of the research team. And so rather than sort of setting up an advisory group or something, is that what they actually tried to do is to say, they actually said, if you're going to get this grant, you've got to find someone on government, and and the idea is that this person on government is going to, make sure that the policy is relevant. It's dealing with real world kind of issues. But the other idea is that then this person would be a change manager or a knowledge broker is what they're called. And that this person then could work within the government organization to make the changes. So it's sort of seen as that, you would get this kind of, this very strong linkage between policymakers and the government by basically embedding the government into the policymakers. The problem with it is is that it put, there's obvious, you think that one policy problem with this would be is that well, it puts this person from the government into a bad position, because if the results come out negative, then the politicians in the government may say, why are you involved in this study? that came out with all these negative type of conclusions about our policies or whatever it's going to be. So it created like that type of tension. But the other thing it is that it also it meant that the government couldn't sort of just have plausible deniability about the results. That is that oftentimes what happens in organizations like government policy organizations is that there's policy will come down from on high from some politician says that we're going to do this. And then there's people in the organization, the members of kind of the staff who know that this is a bad idea, right? They can't say anything about it because it's, this is what their boss is basically telling them to do, but they know it's bad. So oftentimes these are the people who actually want to get independent type of research in there because they're looking to use the research as a way of going to basically making the case above that this is a bad policy that we're doing right now. And that the fact that they can point to something independent and say, we didn't have anything to do with this research, but here's what the results say. It gives the government some type of ability that they're not tied into the research results, but at the same time, they can still use it to make changes internally. There's I'll put online, there's this report that came out from the World Health Organization that deals with a lot of these types of issues. So if you're interested in policy analysis, if you think you may want to go into it at some point, I think it's worth kind of reading this because it does mean it's a different kind of world than oftentimes we think about in just in terms of when we do research like in biochemistry, where you're just trying to publish the results of your research. When you get into policy research, you then suddenly have to get into all these different type of issues. Okay, so the approach that that I think I would advocate for in terms of if you're going to go forward and do this in graduate school is to essentially form, if you think about that continuum, that graph of helicopter science to pure community-based participatory research, is that be in the middle there someplace. Get a reference group of stakeholders. You can, if you're doing policy work, you can get government people on that group of stakeholders. That gives you advice, but doesn't tie you in. That's that you can get their advice at various points along, but at the same time, you're not relying upon them. You're not beholden to them for what they say. You still have the independence as a researcher. And so that's the kind of the conclusion of translational and dissemination research. It's something for which, it's not usually, it's not something that oftentimes people think of when they start off doing their research, but it becomes really, really important when you get to the end of your research. And nowadays it's really important because, one is that if you go into public health, people are going to ask you when you do your research, who's going to use this? What's the next steps? How are you making sure that your research is relevant? All those different types of questions that maybe you're not going to hit if you're in biochemistry, but you are going to hit if you start doing public health research. And the final thing I say is that, that just to reemphasize, even though it may seem like it's, that these journal publications are something for which is just, it's just something that you do, they're really important. And they're really important to kind of provide that independent voice that's needed to make changes throughout the system. All right, any questions about anything? Okay, seeing none, I'll go ahead and stop. I'll send out an email to remind you to take the survey so we can get responses, then to send it out to people and ask them to take the survey. Good.
A question, Dr. Brown.
Yep.
You go over assignment 5. I did get a few questions in terms of assignment 5.
Oh, I have not posted it yet. So what I'll do is I'll post it and then I'll go over it next Tuesday.
Sounds good.
Mm-hmm. Okay. I mean, partly I haven't posted it because I need to see the results from the survey. So that's why Wednesday is, tomorrow is the day when we need to have as many responses as possible by tomorrow, so that we can then go through and write because it's going to be on the final, and it's going to be on for assignment 5 as well. Okay, I think we're done. See you after Thanksgiving.